There is a Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, speaking at the opening of the 75th session of the World Health Organization Regional Committee for Africa. Earlier on, we had Zambia's Health Minister, Dr. Elijah Muchima, echoing very important words, saying the complexities of today's health threats demand that we stand united. No single nation can overcome these challenges in isolation. So let's preview some of the discussions that will happen tomorrow as the summit continues. We're joined now by Family and Reproductive Health at WHO Regional Office for Africa, Dr. Janet Kayita, who is a team leader. A very good evening to you, and thank you so much for joining us. As we heard Dr. Tedros there speak about how particularly women and children are still suffering the brunt of the challenges that particularly the global south faces. So as ministers gather to make these crucial decisions, what are the specific actionable policies and investment decisions that you believe must come out of tomorrow's meeting, particularly when looking at maternal newborn child health?
Thank you very much, and good evening. I think that the framing by the Director General is a very nice way of understanding the complexities that we face, but also the focus on women, on children, on adolescents is a very nice way of bringing a face to the issues. So the technical paper that's going to be presented tomorrow is really talking about transforming health systems to deliver for women and children in a context where we're making progress, but the progress is not sufficient to meet the SDG targets that we signed up to. So the member states in the region already signed off on a number of resolutions that are related, resolutions to do with universal health coverage, to do with the global strategy for women's, children's and adolescent health, a variety of resolutions, many of which reinforce each other. But really the focus of the paper tomorrow is very much focusing on unblocking the implementation challenges. So it talks about three flagships, and the first one is really about investments, health investments being an imperative for development. It's talking about transforming health systems, and it's very much talking about service delivery, so equitable quality services for women, children, adolescents everywhere. And I'll just focus a little bit on that last one that's really about service delivery. So this is about making sure that all population groups, women, children, adolescents, the youth, that the health system meets their broad range of needs. And these are everything from health promotion, disease prevention. When they're sick, it's about diagnosis, it's about treatment, but it's also very much about rehabilitation. It's very much about palliative care. And how can member states do this? It's about defining what is called an essential health service package that looks at all these population groups that I spoke about and thinks about what services should be provided at what level of the health system and the linkages that are necessary across the different levels. Because of course, what you're able to offer at the healthcare facility that is the primary contact of communities is very different than what you're able to offer at a district hospital, and very different than what you're able to offer at a national teaching hospital. So those referral linkages are very critical. And also ensuring that a standard of care, a quality package of care is delivered. And it's very much about the people offering those services. So the healthcare workers, their availability, their equitable distribution, their competences to offer that service, their conditions of service, and so on. So that's the angle on transforming health systems.
Dr. Katia, let me just jump in then, because you've obviously said quite a lot that needs to be unpacked, but one of the initial things that you said was about a need for greater investment. And it's not just financial resources that need to be mobilized. You also mentioned the need to unblock the delivery blockages within primary healthcare systems. Where are the failures, just in terms of the policies might be there, but the implementation is lacking, or I don't know if it's because of infrastructure. Perhaps if you can just speak even from Zambia's perspective, what you're experiencing, where the improvement needs to be focused on, and of course prioritized, particularly for women, children, and adolescents.
Mhm. So you're very right that action has to be at all of the different levels. So at national level, the policies, the norms, the standards, but all of them have to be aligned and they have to come together in a way that's coherent at implementation level. So very much focusing at the subnational level. So how do you make sure that there is the health leadership at that level to deliver services? How do you make sure that you have a good understanding of the population in that catchment area, what their needs are, what the data says about who's being left behind, how you can target those populations that are left behind with the right package of services, making very sure that it's an integrated service, which means that it is everything from health promotion to what to do if, in fact, a woman, a child, an adolescent is sick and seeks healthcare. So making sure that all those different pieces of the health system, from the healthcare workers to availability of medicines to availability of data at that level, governance at that level, participation of sectors outside of health, the local government, education, social workers, how to make sure that everything comes together in a way that serves the needs of the users of the health system closest to to where they are, closest to the community. And again, making sure that the referral linkages work, because yes, the majority of services can be offered at the primary care level, over 90% actually. But for those patients that do need referral to higher levels of care, they are then able to receive that care.
Your health minister at the opening made a very important statement by saying that, you need to deepen regional collaboration, share best practices, but also, underscoring the fact that no nation can face these challenges alone. So partnerships are critical at both a regional and bilateral levels. Are there ones that you would like to point out as Zambia that you have pioneered or have collaborated with which countries, particularly to help advance, better healthcare access for women, children, and adolescents?
So partnerships are especially critical, as the opening statements highlighted out, the especially difficult financing situation that we're in. So in terms of the regional partnerships, the Africa Union and Africa Union organs are especially critical, and this includes the regional economic commissions, but also includes bodies like the Africa Centers for Disease Control and Prevention. It includes multilateral that are already closely collaborating with the Regional Office for Africa, the UN agencies, UNFPA, UNICEF, the World Bank's Global Financing Facility, that all comes together as part of the global movement for every woman, every child, every newborn, everywhere, as part of the Child Survival Action Initiative, but also for adolescents, especially in regional commitments, both for Western Central Africa and also for Eastern and Southern Africa, for healthy, educated, thriving adolescents and youth. So a range of regional partnerships. For the AU, there's a critical partnership around accelerating reduction of maternal mortality, KAMA, that is now KAMA Plus, and that looks more broadly at women, children, but also adolescents. So the campaign to accelerate reduction of maternal mortality, but also the well-being of women, children, and adolescents. Several countries have very active annual campaigns that were kickstarted with the World Health Day on the 7th of April of this year. There's also very strong partnerships in many countries with professional organizations, whether that's midwives, nurses, doctors, obstetricians, pediatricians, around the issues of women and children. Very active civil society organizations, again, particularly youth. The agenda around adolescent health is very much about youth agency, youth voice. So a very important constituency. Private sector is a very, very important constituency as well. So these are the sort of partnerships. We have a range of non-state actors that participate regularly at the regional committee. And these are the sort of partnerships that we'll be advancing. But of course, the foundational partnership is with member states. And there's a very growing ministerial-led movement around women's and children's health. We've been very, very encouraged by the very high level prioritization of women, children's, and adolescent health in this region by ministers of health. So very much hoping to deepen those conversations.
We saw recently South Africa's president speaking at TICAD, speaking about, collective commitment. And he was speaking about an organization of which he chairs the Global Leaders Network. So I want to ask you, as Zambia, the kind of vehicles that you believe will help strengthen, those accountability mechanisms, because the Global South is sharing the disproportionate weight of, the gains that have been lost because of the challenges such as aid cut. What is your next plan in pushing for greater, political will and accountability, but also ensuring that you also strengthen, as you say, those regional partnerships, but mainly towards accountability to change the trajectory for women, children, and adolescents?
So you're very right. And there's a perfect example. In 2017, ministers and heads of state signed off on the Addis Declaration of Immunization. And this is something that is monitored on an annual basis by monitoring indicators that member states have agreed on, and these are monitored on an annual basis. This is where we're trying to move to for women's, children's, and adolescent health. So a set of indicators that's agreed across member states, that's not just monitored through scorecards, because many countries do have scorecards, including scorecards for sexual reproductive health and rights, scorecards on immunization, and so on, but really being monitored at the highest level. So by heads of state, when they have their heads of state summit, we're hoping that this is where we get to. But already for the regional committee, every 2 years, there's a requirement to provide a progress report against progress being made for women, children, and adolescents. And since last year, when ministers of health all signed off on a resolution to accelerate progress in reduction of maternal and child mortality, again, there was that agreement for the World Health Assembly to receive an annual report card of progress that is being made. So really the aspiration is to bring that closer to home and to have that report card on an annual basis and being monitored by heads of state and led by ministers in their respective countries.
Well, we really thank you for your time and honored that you could join us to speak to us about the WHO Afro Regional Summit that is taking place in Lusaka. It took off today, and tomorrow there will be a discussion on how to improve the lot of women, children, and adolescents. And of course, as Dr. Kayita has told us, she's a team lead for the WHO Afro Office for Africa on maternal and reproductive health, saying that there needs to be concerted effort on a number of things, including investments. So thank you very much for speaking to us, Dr. Kayita. And that's where we leave it for now. More stories still to come here on Africa World Hour.